The network was created because as we stepped back and tried to figure out how healthcare is going to change, or is changing, what would be in the best interest of the Mayo Clinic and other organizations with whom we already had a relationship or wanted to develop a relationship. So it allows us to form stronger, broad-based relationships and extend knowledge and expertise across that network. We really think that the best thing in U.S. healthcare is for healthy, independent healthcare organizations to stay healthy and independent. But if we can do something to help keep patient care locally, which we think we can with some of our electronic tools, that everybody benefits. And so those were really the reasons that the network was originally launched. Before we even started the network formally, but when we were just in our conceptual stages, we actually painted a picture of organizations around the country that if we were going to put together an ideal network, who would be in it? And Billings Clinic was on that list at that time.
Well, I think that we made a contact initially, so we initiated a contact, not knowing that maybe they had us as a potential on their list. But there's so many similarities between the two organizations, where the core of the organization is a multi-specialty group practice, the idea of team care, where physicians and nurses and others really put the patient at the center of care and try to be sure that we have the right systems in place to ensure the highest levels of quality and safety. And so Mayo has always been an organization that we felt we wanted to emulate and learn from. And we've actually had a long relationship with them in other areas such as laboratory. Many of our physicians trained at Mayo. And so for us, this was a very enticing prospect. Well, a couple things. I think that the initial utilization, particularly of the e-consults, are likely to be in some of our specialty departments. And as we roll this out, which will start in February, we'll start with several of those and then expand those as the year unfolds. That's how this will start. Potentially any patient who comes to the Billings Clinic who needs this service would have it be available. But the other thing I would say is our physicians have relationships with other excellent institutions that they sometimes work with on complex problems. That might be University of Washington or University of Utah or Denver Children's. And our physicians and their patients will still have the choice that they want to make. There's nothing about this that requires a physician or a patient to utilize the service.
I think that the care that we deliver here is always in consultation with the patient. And if we come across a problem that we feel added expertise would be beneficial to the patient, then we would talk with the patient about the options, about where they would like to have added opinion or added expertise. And sometimes patients have their own preferences. Sometimes patients have had care at other institutions. Many times it's in this part of the world it was advanced care at the Mayo Clinic. So that's a decision that would always be driven by the conversation between the patient and the physician.
There's no additional cost to patients, and that's very clearly part of the agreement on both sides.
It kind of drives home the whole point of this being all about the patients and keeping the patient central and trying to do whatever we can to keep care at home.
Yeah, and the other thing I'd say about that is it may well be a huge cost saver for patients in that in times before this kind of service, you may have had to have the patient go to Rochester and then have the consultation there. So this has, I think, the potential to keep care local. Which obviously has a huge cost savings to folks, and keep the care at the same high level that they would have otherwise.